Well, it is my honor to be able to introduce our keynote speaker, Nanci Luna Jiménez. As Bruce mentioned, I've had the opportunity to work with Nanci previously on some of our other events, and I think you all are going to be coming away incredibly impressed and with a lot of really rich information that you'll be able to bring back to your communities and have some important conversations about. Before I introduce Nanci, I just want to back up and give a little bit of some of the context for why we wanted to have Nanci come and speak at our spring conference this year. And those of you that know me know that I'm a real student of the community health center movement, and so if I ever get a chance to work in a Jack Geiger quote, I will, so here it goes. So in an interview from the 1960s, Dr. Geiger, in referring to the health center that he helped to co-found in Mound Bayou, Mississippi, said this: "Our concept of health is to make social change and to build the institutions that can make social change and keep it going." Now, I know that that's something that for me and for a lot of folks that work in the community health center movement, they find a lot of guidance from that quote and from the work of a lot of the folks that started this community health center movement during the civil rights era. And we've been lately at Northwest Regional PCA and with some of our partners and with our board of directors, we've been having a lot of conversations about what does it mean to be an organization that works for social change? What does it mean to be a just organization? And how can we really effectively be working to address some of those underlying conditions that really create and perpetuate so many of the inequities that we see in our society? So many of these conditions that we know also really have negative effects on health outcomes that you all serve in your community health centers. And we know we've got a lot of issues that are coming at us right now, right? We're got a lot of things keeping us up at night. What's going to happen with Medicaid? What's going to happen with funding for the health center program if we lose 70% of the federal dollars? What's going on with immigration and the patients that are fearful of going into health centers and getting primary care services because of fear of retribution of immigration enforcement policies? So these are all issues that we know are really front and center right now in the work that you all are engaged in on a daily basis. And so with that really being the context, we wanted to have an opportunity this morning to invite Nanci to share why it's so important for us to do the work that we do every day, and why it's so important that we're also making sure that we're looking inward, as she says, as she titles the talk, looking inward to create more just community health care. And that's something that I think that we really increasingly need to be cognizant of, is how are we effectively doing that kind of work, and how are we working with each other, with our colleagues, with our patients, to really create the kind of just society that we want to live in. And so what I really appreciate from Nanci, and what I've learned from Nanci over the year and a half that I've had the opportunity to work with her, is she's really got this profound ability to communicate some very complex social theories and give language that helps us have these kinds of important conversations that oftentimes we might try to shy away from because, we feel uncomfortable talking about things like institutional racism or institutional oppression. But these are issues that we have to confront, issues that we have to address. And Nanci gives us the language that really helps us have those conversations. I'm not going to say that she gives us the answers, and I think she would readily admit that as well, but helps give us the language to have those conversations, to go back to our communities and continue doing the work that we set out to do 50 plus years ago, which is to make social change. So please welcome Nanci Luna Jiménez.
Good morning. Well, I want to say that one of the things I do have, I think, is some language to hopefully apply to your world, but I'm not the expert in delivering primary care, so let me just say that. And it was an honor to get to talk with a couple of folks from your community to give me some insight about what are some of the pressing issues that you're facing in particular and how they could intersect with some of the work that I do on the planet. And a little bit of background about me is I'm probably one of the people that could have walked into your clinic when I was born, and my family would have been the families that you're serving. I'm from a family where we didn't have a job at the time, so we were on assistance. Both my parents are disabled, and I was born disabled, and I was actually born in the middle of the racial uprising in Detroit, Michigan. So it was definitely a time of great upheaval in civil rights movement. It's informed the work that I do. And as I listened to Heidi and Patrick, I know Heidi's not here. Is Patrick here? Can I get like a, there you are, great, it's wonderful. I just want to particularly thank the two of you. There was a way that we got to a place of understanding about what is happening, who is drawn to this community healthcare clinic movement, and what is happening to you as part of a community of people serving people targeted by institutional oppression. And it was a really insightful dialogue and conversation. And I just want to do a couple of quick polls as we start this conference off. How many of you were in another field and came to this movement, this work, later in your career? Like, we're somewhere else. And so raise your hands and look around and see who jumped ship somewhere else to get on this ship. Okay, that's a lot of hands. And how many of you knew from the go, like, this is where you wanted to put your skills and expertise? Go ahead and raise your hands high and look around again. It's a good number of you. All right. And how many of you know that you could be somewhere else probably making a lot more money? Yep. And how many of you, and probably in the last 6 months to a year, have considered that? Okay, I just want to acknowledge that, to be in all honesty. Your commitment is not in question here. In fact, I'm hoping we can highlight that you're here for a purpose. You're here for a reason. And I want to give you a chance to share, just to help set the stage for this conference and this morning. Why are you here? What's drawing you? So I just want to hear from a couple of voices. You're here for a reason. Yes?
To make healthcare a right and not a privilege.
Okay, to make healthcare a right and not a privilege. I'm going to repeat them, but if you can speak it really loud just so everyone can hear us. Someone else. Yes?
Move towards single payer.
As a part of a move towards a single payer healthcare. And for why do you want that?
So everybody has the same opportunities for health.
Thank you. It seems obvious, but I think it's important for us to state it, because Lord knows there is not yet agreement in this United States of ours that would be true. Someone else, we'll take one more. Someone who has a different reason for why you're in the community healthcare movement.
To serve a population that would otherwise not be served.
Thank you. To serve a population that otherwise would not have access to healthcare, quality, affordable, or of any kind, frankly. Yes? Yes, I see another hand.
Okay. Similar to what people have said, but so to make sure that sort of income and zip code is what determines people's qualities.
Exactly. To make sure that your income and your zip code doesn't determine the quality and kind of care that you have access to. So these are some of the reasons, and I really wanted to highlight that.
Hello.
And you're walking alongside people who our society has decided aren't valuable. You know this in the day-to-day, because if we know that your zip code and your address is going to determine whether you live or die, whether you get access to a service that you know is treatable and has great outcomes and survival rates, and yet you know that's not what's happening with the people that you're walking alongside in this healthcare system, you're impacted as well. And I think it's hard when many of us are drawn to professions where we are to give care. It's hard to remember that we actually need care ourselves. It's hard to see that we're the ones that have the access, which is why we're being the advocate or the ally in the situation, and also understand at the same time that we're being impacted by the very oppressions of the people that we are seeking to serve and create access to and give avenues to. And when I talk about this in terms of systems of oppression, This is something that sometimes we really struggle to wrap our minds around. Who is this system exactly? And how is it impacting? And why am I so exhausted? And I think it's one of those things, right? The numbers are bandied about the amount of attrition that is in your field, but we're really not looking at what's underneath why people are leaving. We sort of accept that part of this work is it means that we have to be discouraged and hopeless and feel like we're overwhelmed and not have an impact, that is right and part of the parcel of being on the front lines. And I'm going to say no. I'm going to say no. That cannot be the given for how we come at this work. Because that is what the oppressive society and systems are expecting of you. To get burned out, to feel overwhelmed, to go into hopelessness, and either end up often addicted ourselves, right? Struggling in our own lives with stuff that we stay underground and shamed and hidden around, or leaving, or both, or both. And so how do we begin to understand what are the impacts that this system is having on us? And how do we begin to create practices with each other that really value and build a sense of community and care and hope again? Because the truth is, you are doing some of the most hopeful work on the planet. And yet you're never going to get told that from society. That's not what's going to come at you, and that's not what's going to walk through your door. So I'm going to probably start with something slightly unconventional for a keynote, which is a game. I'm going to ask all of us to stand up and head to the back of the room. You're going to get separated from coffee and food momentarily, but you can return to it shortly, I promise. So we won't need anything in your hands, but we can just head on to the back of the room. So we're going to do an activity right now, and we're going to try and make the best use of the space that we have here. We may overflow a little bit onto the sides, and that's just fine. So I'm just curious, how many of you have ever played the game rock, paper, scissors? So raise your hands high so I can get a visual on that. All right, how many of you have never played it or have maybe never heard of it? Because it is very cultural, it's very specific. So we've got one person, we're gonna make sure everyone reviews it, so you're gonna be on the same playing field, okay? That's really important in this activity. So let me just ask a couple people who have played this, what is this game and when is it played? Who plays it, when is it played, and what is it?
You use it to settle dispute.
Right.
There's two people who have different ideas and both people believe they're right, so you use rock, paper, scissors to decide on what you're going to do.
Okay, beautiful. So there's a disagreement. Two people might play rock, paper, scissors to resolve it. Who plays rock, paper, scissors mostly? Yeah, mostly it's a young person's game, right? And any other reasons we would play it? You play it a lot. She's like, confession. I still play it a lot, right? Yeah. When do you play it? Conflict resolution. So it's a conflict resolution tool. Okay, great, excellent. So just to review, and people play it different ways. So I'm going to review it just so that we're all playing it the same way for this activity because it's going to be important. Okay. So there's 3 hands shapes that your hand will take to indicate whether you are a rock, a piece of paper, or a scissors, okay? So this, everyone can hold up, when your fist is made like this is a rock. Everyone got rock? All right, this is paper. So it's like a piece of paper, and this is scissors, okay. So typically, and I'm gonna ask us to play this way today, you make a table, if you would, with your other hand. So, and you can play left or right, dominant, doesn't matter. Just make a table with whatever hand you're not gonna throw with. We call it throwing. And then we're going to go ahead, and the fist is also neutral, so that can be a little confusing if you're new to this activity. So we're going to keep it in the fist form. I do for 3 times. I know some people throw on 3, but I'm going to have us do 3 times. We would bounce the neutral fist, 1, so you do it with me real quick, 2, 3, and then on the 4th time, you then decide, do I want to stay a rock? Do I want to become paper? Or do I want to be scissors? Okay, so let's do that together. 1, 2, 3, and then throw. All right, does that make sense? I didn't get your name, the woman who hasn't played. Kay, you got that so far, Kay? Okay, so I'm gonna ask you to quickly pair up with somebody next to you. Oh, wait, we have the most important part. So if I threw a rock, who do I beat? Scissors. Why? Because the rock crushes the scissors. Now, if I had thrown scissors, who do I beat? Paper. Why? because the paper will be cut by the scissors, so the scissors wins, right? Now, what if I had thrown scissors and you threw what if I had thrown rock and you threw paper? Because paper covers rock. Okay, does everyone get that? Okay, just for review purposes and for Kay to play for the first time, because we're going to play a variation of this, but I want to make sure we're all on the same page with this. Go ahead and turn to somebody next to you and play a few rounds. Just quickly play a few rounds. Are there any questions? Everyone's in the game now. Can I get your attention back? Are there any questions about how you played that game? Is everyone clear what that game is? All right, so now we're going to play a variation on that, which is sometimes called evolutionary, thank you, rock, paper, scissors. And the way this activity works is you're going to get to play this game, but you can only play with your same species. That's it. Only with your same species. And the way this works is everyone's going to start as the same species, and everyone starts as an egg. Now, I'm going to demonstrate how you identify as an egg. If you can't do this physically, we have an alternative, but it really works best if you can. So go ahead and make a groan if it looks really painful, but we're going to ask everybody to get down on the ground. Yeah, so if you can get down here, that would be ideal. If that's not going to happen for you, then you can do this to look like you're an egg, okay? But ideally, if you can get down. So the way this works is, I'm an egg, and I'm gonna find another egg. So I find an egg, and then we're gonna play rock, paper, scissors, and for purposes of demonstration, I'm gonna win every time. So just know that. Just know that. Okay, so we're gonna play 1, 2, 3, 4. I win, and you are gonna stay an egg. And you keep looking for other eggs to play with, okay? But I have evolved. And now I'm a chicken. So everyone do chicken with me. This becomes important later. Make it your best chicken. You're going to be looking for people doing this, so everyone should be practicing chicken. I know this is ridiculous, but this is the funnest thing about being a young person. So now we're going to play, again, I found a chicken. I'm going to play rock, paper, scissors. And I win. And you de-evolve to an egg. Okay, so everyone, oh, I know, you take a minute. Oh.
Ready for the world.
And I evolve, and I become a dinosaur. So everyone do dinosaur with me. Roar. Okay, so we've got dinosaur going. I'm gonna find a dinosaur, and I'm gonna play rock, paper, scissors. 4, and I win, and you become a chicken. So she goes down 1 level to a chicken, and I evolve, and I become a Power Ranger, okay? Now, for some of you in skirts, this isn't gonna work so well, but if you can do just even these motions, so everyone practice with me, some kicking, some karate chops, yes, okay, great. So I'm gonna find someone who's doing similar motions to me, and I'm gonna play with her. Okay, you ready? Okay, ready? So 1, 2, 3, 4, I win. So you're gonna de-evolve to become a beautiful, and I evolve to become immortal. And we immortals don't play these silly games. All right, so just to review, and we'll just do the movements to go with it. We all start as and evolve to, then a, and from there a, and from there a. All right, you got it? Okay. Let the games begin. Oh, wait, we have a question.
Do you then play another chicken?
You always only play with your own species. Yep, so chickens continue to play with chickens. So if you were a dinosaur and you de-evolve to a chicken, you look for a chicken. If you were a Power Ranger and you de-evolve to a dinosaur, you look for a dinosaur. Has everyone got that? All right, let the games begin. Okay, thank you. It's over. Congratulations, you survived. So we're going to get into a circle, more or less, if we can, and just have a quick conversation about this activity. And I'm going to move over here just for a different view of the room. So how many of you, by the time we ended, how many of you were eggs? Raise your hands high. How many of you were chickens? How many of you were dinosaurs? How many Power Rangers? And how many Immortals? Okay. All right. So it's a very nice thing to observe. We're going to talk more about that as well. Yes, they did seem to cluster together. So what was it like to be an egg? Just a few people to share.
Uncomfortable.
Uncomfortable. Physically, emotionally?
Both.
Both. Okay.
Especially when you got demoted.
You felt small? Wait, I'm sorry, missed that one?
Especially when you got demoted and you had to go back down to be an A 3 or 4 times.
Okay. But really, how was that? So it was hard. So it was hard, but then it was harder to go back 3 or 4 times. Okay. Anything else about what it was like to be an egg?
Just wanted to be a Power Ranger.
Oh. So maybe a sense of longing for something better or something ahead. Okay.
Towards the end, it became harder to find other eggs.
Yeah.
And I was having to travel very far on these little feet.
Okay, so a sense of maybe losing community, a sense of connection there happening. Okay. How about for chickens? What was it like when you were a chicken or passed through chicken?
Humbling that I was only able to evolve to a chicken for me.
Okay, so by the end you stayed a chicken? No. Oh, but it was humbling at that moment that you were like all that effort and you're a chicken.
Awkward.
Awkward. It was silly, it was awkward. Okay, anything else about chicken?
It's a sense of relief.
Because?
I evolved.
Good. I'm not an egg anymore. Phew, okay.
Security, I could become an egg again.
And insecurity because you could lose it. It was a temporary status.
Sense of growth.
Yeah, and also a sense of growth. Okay, and how about for those of you who were touched dinosaur? What was that like? Is there a word that goes with that sound? That's a great sound.
Empowering.
You felt empowering?
It was nice to be that far away from being negative.
Okay, so a sense of distance, felt victorious.
And I'm on my way. There's more to come. I can do this.
Okay, so a sense of encouragement, I can do this.
Worried about extinction.
It's true, they didn't make it in the end. It's true.
Safe.
Safe?
Yeah.
Okay, safe in what way?
Kind of invincible. You're a dinosaur.
Okay. Yeah, you're taking up a little bit more space. You've got this like powerful title of dinosaur.
Chickens are afraid of you.
Okay.
Dinosaurs went extinct. They didn't do very well.
Yes, they didn't make it, which takes us to Power Ranger. So for those of you who got to Power Ranger, what was that like?
Cool.
Cool. What was cool about it? Okay. So you're definitely taking up even more space, right? As the Power Ranger was kicking. Other things about Power Ranger.
Couldn't find other ones.
Yeah.
It wasn't hard on us.
So it's harder to find. Yeah.
More powerful.
You felt more powerful. Okay.
Very unique.
In what ways?
It wasn't, like you said, you couldn't find another.
Okay.
So you were.
Okay, so a sense of like they're not everywhere,
Yes.
they're special. Okay. Anything else about Power Ranger? You're safe? Okay. Almost there. Yeah. So now the stakes are a little bit higher, right? When you got to Power Ranger, did anyone feel that pressure of like, uh-oh? Yeah. What was it like to be immortal? Awesome. Awesome. We made it.
And there was a sense of relief. I don't have to do that anymore. It was also, you felt yourself like distance from everybody who was still fighting. So it's when you like notice everybody else is standing over here, and I gravitated toward everybody else who wasn't mingling around anymore.
Yeah. So there's a sense of distance, and you didn't use this word, but I'll just check it out with the Immortals. Maybe disconnection. Mm-hmm. Yeah. Anyone else from the Immortals want to talk more about that piece at all?
I felt like I won.
You felt like you won? Did you win?
Right there.
So I think that's part of the question we're going to explore a little bit today. Anyone else from the Immortals? Untouchable?
You kind of felt bad for those that were continuing in the battle.
You felt bad for them.
Yeah.
So a sense of pity for others, maybe a touch of superiority. You didn't, okay, there we go. I didn't want your pity. Okay, so noted. Most of us don't want other. How many here do not want other people's pity? So notice that. And yet that was part of the dynamic that I set up in this activity, isn't it? Yeah. So just out of curiosity, how many of you noticed, and you don't have to have, how many of you noticed that in order to evolve, someone else had to de-evolve? How many of you just noticed that? Just raise your hand if you noticed. How many of you did not notice? Like you were just in the game and you were kind of just, yeah, it's fine. That's their problem. That's right, exactly. I'm doing my thing, you do yours, right? Okay, cool. How many of you, when you evolved, felt something? Good or bad, just had a feeling? Okay, how many of you felt bad that somebody was de-evolving? How many of you felt good? Like, shoot, I am awesome at this. Yes, I am. How many of you felt both? You can feel both, right? People are complicated. We can feel two things at the same time. Okay, how many of you noticed that in order to evolve, you had to beat your own kind? Your compa, as we would say, your compatriot. Okay, 2 of you. How many of you did not notice that it was your same species that you were taken out, basically? Raise your hand high if that wasn't, yeah. Okay. What was that?
I said pretty deep this early.
It's pretty deep this early. You know this funny thing? Oppression is everywhere all the time. It's even when we're sleeping, it shows up. I hate that. So I am curious, how many of you would you say, what do you think this activity is meant to explore, given what you're experiencing?
Just the dynamics of our socioeconomic, the different statuses, you know. Sometimes, like for example, if you take like parents selling their house and what they've built so their kid can go to college, there's that separation more sometimes, or medical things, whatnot. There's so many variables and shifts happen a lot.
Okay, thank you. Anyone else want to add? Yes, please.
That it's fragile, that you could have lost it all at any moment.
Any moment, yeah. Thank you. That whatever you feel that you've gained can be lost very quickly. What else? Yes.
For me, it was that idea that, I mean, I was happy that I won, Immortal, that's cool, but there was no guarantee that there was going to be a win. That's just where the hands landed up. I couldn't have built the skill up to make that change.
Yeah, and I will tell you, people have argued with me on this, and someone may argue with you here. How many of you felt that you got to Immortal because you figured out how to win the game? Like it was your skill, like you figured something, okay. Yeah, it was random. It was random. It was luck, right? And yet how many of you from the outside, when you saw the Immortals, how many of you were like, oh, what did they do? They figured it out. My gosh, they were I wanted to be them and I didn't get to be them, right? And how many of you that didn't make it to Immortal internalized it was something you did wrong? Just for a split second, like it didn't go your way. There was a barrier. Somehow something didn't work in your favor, or you just didn't work hard enough. How many of you felt that just for a split second? Yeah, I can tell you, everybody was working really hard. Everybody was working really hard. The system was set up that not all of you would be immortal. It just wasn't going to work that way from the beginning, right? Who am I in this activity? Who am I?
You're the boss.
The boss. I think in a class system you could say that. I'm the man, I think is sometimes a shorthand for it. I'm oppression, right? I'm institutional oppression. And look at how clever I was, right? I knew how to entice you, right? I knew what the reward system was that you would respond to. Instantly, you all went right into your roles. You knew exactly how to do this, right? You've been trained to do this. Because in an oppressive society, we're all getting these messages regardless of where we are on the scale, of whether we're looking at class, or we're looking at age around adultism, or we're looking at race. It doesn't matter. We all get the messages from birth about what has status and what is devalued.
You also cut the game off before there weren't too many people, while there was still a minority in the world.
I would say I was pretty close to about half at that point, but yes,
You control how long it lasts, because eventually there will be probably more people eventually over time.
Eventually, but still not everyone. And that's part of the illusion of oppression, is that it sets up the expectation that everyone can win, but not everyone's going to win. And I get to set you up that way. And in fact, I even made it enjoyable. I'm going to call it a game, right? And you're going to have fun. You're not even going to notice that it's happening. So I see a hand up here.
It even sets up the illusion of a win. What is a win? It's the game itself is a competition as opposed to a collaboration. And when there's a system that's set up in a competitive way, it creates an artificial more than, less than goal, as opposed to everybody being equal and sharing their resources, and then everybody moves forward.
Beautiful. And I think that was the piece where I wanted to question the idea that immortals were raising, that they felt that they had won. And you know, the dynamic, which I really appreciate you said, I felt sorry for them. It does set up the dynamic of superiority and inferiority. It does set up a place of condescension and pity and paternalism. That's the setup. And yet, if we look at what happened to the immortals, they got disconnected. Right? They got separated. They talked about a feeling of distancing. And there's a reason why isolation is a form of torture. There's a reason it's in the Geneva Convention that you cannot isolate human beings, because we are social beings. And to lose that sense of connection is a form of hurt. But it's one that's couched in the illusion of victory and success that I've defined, the system in this case. I saw a couple hands.
The sense of individualism, so I forget who it was like, I'm still a chicken, and I thought, well, maybe I should lose so that she can become dinosaur. But it happened so quickly that I just kept thinking about, no, I need to make it to being an immortal versus helping my fellow chicken.
Yeah. That's a quote that's going to go down in history. And I also want to highlight the language of helping again. So still, if we're in a helping mode, there's a sense that I have something you want, and that the gain, we're still reinforcing the illusion of winning and what the gain looks like. So it's so embedded, the paternalism within the system of hierarchy. So I'm going to see a hand here, a here, and here. And I know you've had your hand up for a while, but I don't know if you want to still speak to it.
Right, I thought the egg was the best. You had the most potential, and it was like, what's there to lose? You know? It's when you're immortal, you're kind of like, I am the person. When he's my boss, so I'm kind of, I am like, who's going to do next? But
So I do want to highlight, and I want to come back to this, like at what point were you potentially having the most power to change the system? So if you can hold that thought, I want to come back to that line of questions.
Question for the immortals. Did you guys find a pattern? Because I started to find a pattern of what people were doing, and then we ran out of time. I was like, oh, I got the pattern.
So just so you know, there's no pattern. It's the illusion. I think that's one of the things. Yes, it's the illusion. I think that's one of the things. It's really luck. 50-50 chance every time. I think that, again, it's very seductive to think there's a way through this. Yes, Sadie.
I would like to speak to the mortals, comments about the egg, because as an egg, spoken like a true mortal, right? As an egg, I felt like it was really hard to be an egg. It was really hard. You were down there. Everyone else, it looked so much easier. They're kicking, they're having fun, and it just seemed like being an egg started to be harder and harder, and sort of losing that, well, I'll never be able to stand up to this. You know, it just was really hard. Seemed a lot harder than the other levels.
And I think what happens, and again, this is, how many of you stayed egg almost the whole activity? And I mean, I'd be curious, how many of you started to get discouraged? Yeah, how quickly that discouragement can get triggered. So the fact that you're feeling discouraged perhaps in your work and the impact that you're doing is, we tried to recreate that experience physically right here, how quickly these discouragements will come up. And I promise you, and I know this is going to be, you're going to have to go on faith a little bit with me here because I don't have time to do a 3-day workshop with you. But the feeling that you had of discouragement is not about this activity. The feeling that you have about discouragement in your day-to-day work is not about your job. It's accumulated effects of discouragement over time from a long time ago. Because the truth is, how could we be anything except hopeful about the future? It has yet to be written. And yet most of us anticipate the discouragement and the barriers of our past when we vision the future and what's ahead. And so that's the piece where the system gets in our minds. And then we start to self-fulfill. It knows how to trigger us into the place of feeling better than or less than, the place of feeling discouraged and hopeless and burned out. It knows how to run that systemically. And then you look around and you see all the other eggs feeling discouraged, and then it validates the fact that you're feeling discouraged because, well, they're discouraged, so this must be a real thing because I'm feeling it too. And there isn't a perspective outside of the system to give you a window into what is truly a human experience of hope, like real hope, not fake hope, not Pollyanna-y, like everything's going to be great, but a genuine hope in human beings and who we are. Because the truth is, no system is bigger than we are. No system is more powerful or more brilliant than the minds that are gathered in this room. And if you have a clarity about how you want to destabilize the classism that you see running and the institutional oppressions that your patients and people that you are giving care to every day are facing, you have the power to do it with them, not for them. There's no helping. You're not trying to get them to be immortal. You're trying to debunk a system that even has you separated in the first place and believing the separation. So I'll take 2 more comments. I know there was a couple of hands up, and then I'm going to have us go back to the main room.
In this game, at the end, were there like more eggs? Because in society, we kind of have this, there's a lot here and only very few here. Is it sending out here or is it too random?
It's not exactly replicating society in that way, because the truth is I could have set it up to be even more barriers and even fewer people would make it to immortal, but I wanted to give people the flavor of the movement. But there's actually much less mobility in society and increasingly less mobility between these different categories. Yes, thank you for that clarification. Yes.
So I was just curious, given that you were the system,
Yes.
you were the man,
Yes.
did anyone...
And I'm saying men are good, just for the record. I'm just literally standing in for a phrase, yes.
I was just curious if anyone decided not to play from the beginning.
Oh.
Just one person. And what was your reasoning?
Again, it's a reflection of the artificialness of, I mean, it's an excellent, it's not, it was an excellent representation of what you were trying to present, but I think the only way to win at a game like that is to not play.
And I hear, I'm one of the things we won't have time to explore fully is how could you have changed this system? And we can point to a whole class of society who are separating them out, but it's not changing the system. And I hear what you're saying, like, if this was a no-win, and you knew it was a no-win, so you're like, I can't win, why would I even bother? And you don't want to participate in continuing the system that is, and the truth is, stepping out didn't stop the oppression from playing.
Right.
Except she's still getting an egg, so...
But there wasn't another option.
So, darn it, I want to spend time here, and I know we need to go. So, just quickly, let me just say, and I'm cutting to the chase here, but I would really want you to spend some time thinking about this in your own worlds. The option would have been to organize. If you'd been able to find enough people who weren't willing to buy into this, not as a radical outsider, we're going to be anarchists, but rather how do we question the very assumptions under which we've all agreed to operate? I find relationship building is the act of revolution, where we are connected to other human beings, not distanced by title and degree and by species, and I'm using species here metaphorically, where we can hear each other's pain and share our own authentically, where we can decide to know about each other's families and share about our own. Then we have this capacity to build trust. And with trust, we can make systemic change happen. But without the intimacy, and I want you to think about, in the guise of professionalism, how disconnected you are from each other as a profession. Forget with your patients. Forget with the people who walk through your door, your clinic door. Each other. How much of a conference is actually spent doing intimate connection time with each other? And maybe this is the one time a year you see each other. How many of you are working side by side for years and don't know each other? Don't really share about what's going on for you with each other. This isn't your fault. This is the system. This is what got set up. And it's in the name of being professional that we collude with it. That, and we don't have skills and tools to deal with the pain that we're facing, which I believe is contributing to the burnout that you're experiencing and the discouragement. There is real pain that you're experiencing every day at work, and there is no place for you to go with that and not be seen as either weak or the problem yourself, or you didn't know what you signed on for, you're not a real professional, if you're feeling these feelings, all of the ways that we judge each other and rank each other's effectiveness. And that's going to be crucial for us to undo. So I know we could spend more time here, and I hope that you will. I hope over the course of these next 3 days that you have together, that you will continue to unpack your insights from this activity. But I want to transition us to a tool that I'm hoping you will take from this morning and embed in your lives as a practice for building relationships, for touching intimacy. And I mean intimacy in a sense of communication, not sexual, because you could be sexual and never be intimate. We all know that. And be intimate and never be sexual. It's the ability to be outside of pretense and role and posture and degree, and to be humanly authentic with each other. So I want to give you a chance to practice and experience that tool as a way to rebuild each other, as a practice that's authentically about what I call self-fullness, not selfishness, but self-fullness, that you can refill yourself. So on your way back to the tables, I'm going to ask you to find one other person to partner with. And we need to do this very quickly just because we don't have a whole lot of time. So someone to partner with, it would be very helpful if when you got back to your tables, it doesn't have to be going back to the table you were at. In fact, I encourage you to not go back to the table you were at, but to find a different person and a different table. But turn your chairs to face each other so you're not facing the table, but actually what we call in this work knee to knee. So it's as if your knees were going to be touching. They don't have to be touching. Is everybody in pairs? If you're not in pairs, we can make it work. We just need to adjust the timing, so I just need to know. All right, so if you haven't introduced yourself yet, go ahead and share your name with the person who's sitting across from you. I'm going to give you just a few guidelines, and then you can go at it again. So I'm not trying to interrupt this. This is beautiful. This is a tool. It's called Constructivist Listening. You will not be quizzed on this later, okay? But it was labeled that by a mathematician. His name is Dr. Julian Weisglass. He's one of my dear mentors and colleagues. And essentially, by definition, Constructivist Listening is a timed, confidential activity where the speaker and listener get the same amount of time in both roles. That's essentially what it is in a nutshell. You need 4 things in order to do constructivist listening. And so at the end of this activity, you're all going to be experts, and you can teach anyone you want to do this, so you're not going to be restricted. But right here, you have 199 other people who already know it, and you can use the tool with. Okay? So we want to build this as a practice that will be ongoing in your life, if it's one that you find works for you. So the 4 things that you need a designated listener and a designated speaker. So right now, decide who's going to speak first and who's going to listen first. You're going to be in both roles, but right now in your pair, decide who's going to speak first and who's going to listen first. So just so I know, all the first speakers, raise your hand so I can see everybody's got one already. Awesome. Okay. So that's 2 of the 4 things right there out of the way. The third thing you're going to need is a countdown timer. Now, I know our phones do all kinds of things, including countdown, but they do all kinds of things. So I find them to be very distracting when I'm doing this activity. So if you can, just get an egg timer, or I got this at Radio Shack, like something that really its only role is to count down time. That's all it is. That's the third thing you need. The fourth thing you need is uninterrupted time. Now, how many of you have uninterrupted time just hanging out on your calendar? Just curious if there's anyone else out there. No. So uninterrupted time doesn't show up, right? We have to carve it out. We have to create it. And what we're going to create and carve out right here is 6 minutes of uninterrupted time. 6 minutes total. So what that means is each of you will have how much time? 3 as speaker and 3 as listener. Great, so now you all know what's involved. Here are the guidelines. I'm going to ask that the speaker owns the time. In other words, the speaker can talk or not talk. I'm going to give you a topic. You can do my topic, or you can ignore my topic. You can sit in silence. You own the time. It doesn't matter. This is a really radical thing, right? Most of us are used to, when we get attention, we have to perform, be really articulate, come up with really great stuff. This doesn't work that way. You own the time. The listener does one thing and one thing only. Listen. What does listening look like in constructivist listening? It looks like warm, focused, undivided eye contact for the full amount of time. So no matter what, listener, you give warm, focused, loving eye contact to the speaker for the full amount of time. The speaker could be, anyone need to giggle? Go ahead and giggle. This might feel super awkward, and that's okay. As someone in my workshop says, well, I thought I came here to feel good. And I was like, no, you came here to feel. Like, we're going to unnumb to the ways in which we have to function in an oppressive society that expects us to be numb. So the speaker could be talking or looking away or whatever, but if they ever come back to look at the listener, they're going to find their eyes on them. Okay, so that's the key important thing. So that means as the listener, you don't ask questions, you don't interrupt, you don't interject. Okay? You don't ask questions, and the confidential part is really important here. So the confidential part happens in that you don't ever bring up later what anyone shared during their time as speaker. It also means that if you go second, you have the added piece that if you go second, you don't refer to anything the first person shared during their time. And that can be the hardest thing because we want to connect and bond and refer back to let them know we heard. But this model says no, actually. That becomes a violation of trust. And we're going to ask that when I call time, when the timer goes off and you hear those chimes again, you forget everything that you heard during those 3 minutes. It's really, really important. The last piece of this that I think is important for us to remember, and I think actually there's 2 more. One is you've got this knee to knee. That's really important. So it's really hard to show that you're really listening to someone when you're like this, right? Already it doesn't feel like you're listening to them, right? So you want to be facing your full body towards them with nothing between you. And what this does is it communicates that there's no distractions or barriers. That also means that you're not going to drink, you're not going to eat, you're not going to play with the pipe cleaners, or you're not going to start to fiddle with your coffee or drink something, like anything like that. So you're going to not have anything in your hands, you're going to give the undivided attention, and you're going to be focused with the speaker during their full time. And finally, the last one is that because we experience our emotions in our first language, I'm going to invite everyone to do this in the language that you curse in, count in, pray in, dream in. And for some in this room, that will not be English. And I want you to know that this really is not about the listener understanding what you're saying. In fact, you're probably helping them keep confidentiality if they don't understand what you're saying. So think of it as doing them a favor, all right? This tool is really about meaning making for the speaker. It's really about meaning making for the speaker. So is everyone clear what we're doing for the next 6 minutes? Okay, so I'm going to give you your topic. And again, you're in charge of how you want to follow this or not. But what I'd like you to work on is, where do you feel discouraged? Where has some of the hopelessness started to seep into how you're showing up? And then would be the pro tip or the advanced version if you want to keep going. Where's your earliest memory of when you felt discouraged in this way? Because it didn't start last week at work, I promise. So if you can identify the piece where you're feeling it and then follow the thread back to as early back as you can remember, you're going to get a better shot at nipping it in the bud, of going back to the root of where that discouragement got, so you won't be as vulnerable to it in the present moment if you can go back early. So it's up to you. You can work on where it is now currently, but if you can go back early, we would encourage you to do that. So where are you feeling discouraged or hopeless right now in the work that you're doing? And if you're not feeling discouraged or hopeless at all right now, just work on where did you first feel discouragement and hopelessness that you're seeing around you in the office? And where do you feel ineffective in interrupting it in the clinics that you're working in? Okay? So I'm going to set my timer for 3 minutes. And everyone knows who's going first already. So first speaker, You may begin. So that was time. If you'd like, you can thank your partner for their attention of listening or what they shared. And we're going to go ahead and switch now. So if you were the speaker, I'm going to ask you now to give your undivided, focused, loving eye contact to the speaker, the second speaker, for their full time. And again, the second speaker, please don't refer back to anything you just heard during the first person's turn. Cannot refer back to it. All right? And please do this in the language that you curse in, count in, dream in, pray in. Where are you feeling discouraged or hopeless? And what's your earliest memory of feeling that way? You may begin. That's time. If you'd like, you can thank your partner for their attention and or what they shared with you. And in the time that we have remaining, I just want to start with doing a few raising of hands just to get a sense of how this impacted you all. So out of curiosity, how many of you feel a little less discouraged after that 6-minute exchange? A little less discouraged. How many of you can't tell that there was a difference? And that's fine. Okay. How many of you feel more connected to someone else? Maybe have a sense of it having had an intimate connection, a sense of honest, authentic sharing. And how many of you not so much? Okay. So let's do that last one again, because I think that was 100%. So raise your hands again if you feel more connected. That's a big deal. That's a big deal. That took 6 minutes. 6 minutes. People tell me, I don't have time for that. I don't think we have time not to do it. Not to do it. What do you think some of the impacts will be on you having had a deeper connection? Just in the course of this conference, what do you think some of the impacts will be for you?
Yes, I need to spend more time with Jean.
Okay.
He needs to spend.
Jean's going to be very, very busy all of a sudden. Yes. Okay. So a sense that you want to know someone more deeply. Okay. So that's something that's going to impact you just by virtue of this experience for the conference. Yes.
It removes the isolation that sometimes we feel that we're the only ones in that spot. So I feel like I know one more person that's just as frustrated as I am.
Yeah. And I think what's key here is that oppression, so isolation colludes with oppression. They go hand in hand. You see, if we can keep you isolated, thinking that it's an individual problem that you're having only at your clinic or only you personally, then we won't see that there's a systemic issue that needs to be addressed that's bigger than any one of us and has actually set us up to internalize our failing and frustration. So any time that we are breaking isolation, we are in an act of revolution, I believe. Because it undermines the effectiveness of systemic oppression where we're connected. That act alone is profound. That act alone. So how do you think this could impact, if you decided that you wanted to make this a practice, how do you think this could impact your work and possibly your life if you continued this beyond the conference? Anyone have a guess?
Better sense of community.
A greater and better sense of community. Beautiful. Someone else? Oh, there's one right there.
I think it would inspire more honesty.
It would inspire more honesty. And what do you think that would render? What do you think that would give us if we were more honest? More collaboration, less competition. Yeah, perhaps better outcomes as a result. If we follow that thread. Yes, thank you.
It changes the social structure. You look at that and you have, it would seem like patience or something, you could say, on our level. and see a doctor. So you go up, supervisor. To me, it just seems socially.
So it changes the social structure for yourself and for your patients. Okay, I see a couple more hands. I know we've got beautiful mic runners right now, so thank you so much for doing that right here.
I think it generates authenticity.
It generates authenticity. And what will authenticity yield for us? Trust. Trust and connection. Yep, I see it. There's someone else has a mic now, and I don't know where you are.
I just wanted to say I'm not feeling discouraged in work, in what I do, because I know there's a cause.
Yes.
However, in my social life, when I go home, my friends, I work with the homeless, and a lot of my friends are Christian, and they don't believe in healthcare, a lot of them, and it shocks me.
Yeah.
And so it's isolation from them.
And that is profound. And let me just say that disconnect between who you are and having an intimate connection in your social circle, having them not understand that, this tool can be very powerful in building up your resources to stay connected. Because I think one of the most painful things that I'm experiencing right now in our society is the capacity to block, unfriend, disassociate, divorce people who don't think like us. And that used to not be a criteria for connection. And in fact, I think we've lost some set of skills to be able to stay in there, even if we disagree. I have a dear friend who recently got married, and she found out that her husband voted for the other candidate, not the one she voted for. So we'll just say that happened. And she said to me, if I hadn't married him, I would not be with him. And I said to her, I wish we could all get married to each other then, because there's something about knowing that we can't go away that will have us all rise to the occasion of figuring out what our values are here. And we all get to be impacted by deciding to listen to, love, and learn from each other in a way that when we separate, we won't. So if we can give you this tool and you can make it a practice, my goal is that you can stay and listen to your Christian community friends who don't believe in healthcare and still love them unconditionally, and still figure out how to create space for wherever they got disconnected to see that their success is deeply and inherently connected to their neighbor's success, because we've lost a sense of that. We have very much, myself included, internalized everyone's out for themselves. Pull yourself out for your bootstraps. If you can't figure it out, it's your own failing. You didn't work hard enough. And we all know the stories. But those stories are real for many, 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 many of our colleagues, and maybe for some of us in this room. I don't make assumptions. And we want to understand, where do those come from? Because there's a real piece of someone's life there, of a family struggle to overcome. And I want to value that and validate that. Even if I disagree with it, it is valuable and validating. So there was, I think, one last microphone happening back here. Okay, great.
One of the things that I think that is important is you get to know somebody, so then later down the line, you kind of understand why they do the things they do, instead of jumping to conclusions about why they might have done something or felt something. If you get to know them, getting to know what's happening outside of work, because outside of work can affect your work.
Absolutely. We are not just robots that show up at work and don't have deeper lives, or stories that only started with our careers, right? And any chance that we get to understand why a behavior might be coming from someone's experience, we're going to have greater understanding just by virtue of that intimate connection. So again, I'm hoping that you're leaving with a sense that this is a tool that's very practical. Let me just say, it doesn't work if you get together and just have a conversation. It doesn't work. You won't get the experience that you just had here if you're just like, oh, let's get together for coffee and we'll do that thing we did at the conference over coffee in a cafe and we'll just talk. It doesn't work. You do need the 4 elements: the designated speaker, the designated listener, a countdown timer where you get even time, and the confidentiality that you're never going to bring up anything that you shared. It has to be what we call in this work a sacred space of building trust. The more that you can build that as a practice, the more benefits that you will see from this work, both, I believe, in your personal life and in your work life. But I look forward to hearing if that's not true, or if it is true, that we can hear it from you. So I know that we're coming to a close from our time together. and I want to be honoring of what's coming next, so I know you have a very full day. There are a couple of quick announcements that I want to make before I close. One is that there are sign-in sheets on each table. If you sign those sheets, we will add you to a mailing list so that you'll learn more about the kinds of work that we're doing in an ongoing way. Opportunities perhaps for you to attend a longer workshop where we would develop these skills and these tools more deeply, and hopefully a place for you to come and get some of your own self-full care on your journey of understanding the impacts of oppression and inequities, both on not just the people that you serve, but on yourself and on your field, on your organizations. So that's a very specific piece if you want to stay follow up with us. The other thing is that on your tables, we do have evaluation forms. And I know people get overwhelmed with evaluations at conferences. Let me just say that we're doing something a little different here. I mean, I think Seth took a risk, and as did the whole association, to bring in this type of topic. I suspect this is not a typical topic for your conference. Would that be fair to say? Maybe as someone quoted in a orthodox, very little orthodox, a little unorthodox. So if you would take the time to fill those out and give us suggestions for how this could have gone better for you or what really worked, that will certainly help the conference planners and organizers going forward. They really do want this to be a responsive conference to your needs and what you're up against. So please take some time to do that right now before we transition to the break and to the next session. And finally, I just want to call your attention. We are about to release a video, which are the highlights of this 3-day workshop that have some key teachings in it. If you want to become familiar with them, it's not a substitute for the training, but it can be a way into this work. And besides, you'll get to see Seth in it because he was actually part of the videotaping that happened last July. So if you would like to be a part of that, there's some flyers on the table as well. So I want to acknowledge that. And finally, I want to take some time to really, again, thank Patrick and Heidi for the trust that they had in me to share and give me a little window into the world that they have had such a great impact on impacting, and also what are some of the struggles that you're having as a community. I really want to also thank the planning team, so Marlene and Sadie and Seth for testing out whether that was true or not and really coaching me to how to reach you and think about this topic with you this morning. And my team, Kelly, who's been behind a camera and right there, and Melissa, who also were an essential part of this work. And Bree and her team, I know, have been doing some social media as well. So it really does take a village. I feel like one of the beautiful things in my work with the association is I feel like I've built a family and community here, and I feel like that has yielded the connection that I've been able to make with you here today. I hope that it has had an impact and that you go forward into the conference with a different perhaps view or frame of reference for how you might approach this work and each other, and really see this as an opportunity to deepen intimate connections with your colleagues for the purposes of long-term sustainable social change with intimacy and trust and love at the center of it. Thank you for your time and attention this morning. It's been a pleasure to be with you.